Welcome to this explainer. Today, we're diving straight into a microscopic threat that literally has the power to turn totally ordinary everyday chores into life or death emergencies. We are talking about Hantavirus, a seriously dangerous viral infection that operates almost entirely in the shadows. Now, I know what you're thinking. Could sweeping a dusty floor really be deadly? It sounds like an extreme question, right? But by the end of this explainer, you'll understand exactly why sweeping out your dusty garage or, cleaning up an old abandoned cabin could actually be a fatal mistake. We're going to unpack how this virus operates, what it does to the human body, and most importantly, how you can easily protect yourself from it. Section 1. An invisible viral history. To really understand the danger here, we've got to look at how this disease emerged. Picture this. It's the early 1950s, during the Korean War. Thousands of soldiers suddenly developed this mysterious, severe fever paired with kidney failure. Well, scientists eventually linked the illness to rodents living near the Hantavirus River in South Korea, which is exactly how the virus got its name. Fast forward decades later to 1993, and a deadly new outbreak absolutely shocked the American Southwest, when perfectly healthy young adults started suffering from sudden, severe lung disease. Researchers pinpointed this as a new strain, calling it the sin nombre virus. And today, infections are reported globally, everywhere from China and Russia to Argentina and Brazil. So the big takeaway here is that Hantavirus isn't just one single rogue bug. It's actually an entire family of viruses, the Hantaviridae family. And their defining trick? They use common everyday rodents as their secret delivery system to infect humans. Section 2. The vectors and the victims. Now, this is where it gets really fascinating. We're talking about standard rodents, deer mice, cotton rats, rice rats, and white-footed mice. Different rodent species actually carry different hantaviruses. But here is the real kicker. The rodents themselves usually don't get sick at all. They carry this highly destructive virus around, but it doesn't harm them in the slightest. Instead of getting sick, these rodents act as a biological reservoir. They shed the virus completely invisibly in their urine, their feces, and their saliva. Essentially, they leave behind an invisible trap in their waste. And this brings us right back to our opening question about why a simple broom is so dangerous. When that waste dries out, the virus doesn't die. It's still there, just waiting to be disturbed. Because of this, specific groups of people are at a much, much higher risk. If you're a farmer, a camper, a hunter, or someone who cleans out rodent-infested buildings, you are a prime target. Anyone living or working in areas with poor sanitation who might breathe in dust contaminated with this waste is vulnerable. And get this, you don't even have to be bitten. Just breathing in that contaminated dust or touching a contaminated surface and then touching your face is totally enough to get infected. Section 3. A tale of two syndromes. There is an incredible geographical divide with how this disease actually attacks your body. Depending on where you live and which specific strain you catch, the virus targets entirely different vital organs. Over in the Americas, the disease usually presents as Hantavirus pulmonary syndrome, or HPS, which goes straight for the lungs. But if you're in Europe or Asia, you're much more likely to see hemorrhagic fever with renal syndrome, HFRS, which aggressively attacks the kidneys and blood vessels. I do want to share a bit of good news here, though. Unlike viruses such as Ebola, most hantaviruses do not spread easily from person to person. Human-to-human spread is incredibly rare. Now, a few isolated strains in South America have shown very limited person-to-person transmission, but for the vast majority of cases, the rodent itself is the direct source. Section 4. Symptoms and survival. This virus is incredibly deceptive. Seriously, for the first 1 to 8 weeks after exposure, there's a completely silent incubation period. You won't feel a thing. Then, when the early symptoms finally hit, fever, fatigue, muscle aches, chills, maybe some nausea, it just feels like a bad case of the flu. But then it rapidly plummets into a life-threatening emergency. For HPS, patients experience terrible coughing, chest tightness, and fluid filling up the lungs. For HFRS, it's dangerously low blood pressure, bleeding problems, and full-on kidney failure. Because those early signs are total copycats for common illnesses like influenza, malaria, or pneumonia, getting a diagnosis is a literal race against time. Doctors must urgently rely on blood tests for antibodies, PCR testing, and honestly, most importantly, your clinical history. If you've been around rodents or cleaning out dusty spaces recently, telling your doctor right away is absolutely critical so they can catch it in time. Here's the harsh reality. There is no specific, universal cure for a hantavirus infection. Medicine cannot actively kill the virus once it's in your system. All doctors can do is keep your body running, essentially buying you time while your own immune system fights it off. This makes early hospitalization the single biggest factor in drastically improving survival chances. And this supportive care, it is intense. We're talking oxygen therapy, mechanical ventilation for breathing problems, intravenous fluids, and sometimes even kidney dialysis for severe renal disease. Plus, even if a patient survives that grueling intensive care, the battle still isn't over. Survivors often face weeks or months of tough recovery, battling chronic fatigue, reduced lung function, and significant psychological stress. It's a massive physical and economic burden.
Section 5. Defense and Prevention.
So, with severe symptoms and no cure, how do we fight back? Well, public health organizations like the CDC and the World Health Organization emphasize that your absolute first line of defense is simply keeping rodents out of your living space. This means meticulously sealing up holes where rodents can sneak in, storing your food in hard, sealed containers, disposing of garbage safely, and, if you're a camper, making absolutely sure you aren't pitching your tent near rodent nests. Okay, listen up, because this is absolutely crucial. If you do find rodent droppings, never sweep or vacuum them while they are dry. Remember that invisible trap we talked about earlier? Dry sweeping literally aerosolizes the particles. It launches that deadly virus directly into the air and straight into your lungs. Instead of grabbing a broom, you've got to follow a very specific, safe cleaning routine. Step 1, gear up with protective gloves and a mask. Step 2, spray the area heavily with a disinfectant first. By wetting the dust down, you completely prevent the virus from becoming airborne. Step 3, use paper towels to wipe it all up. And finally, Step 4, wash your hands thoroughly afterward. Which brings us to our final thought for today. The next time you open up a dusty garage, a shed, or find a mouse nest tucked away in a corner, are you going to reach for the broom or the disinfectant? Keep this critical difference in mind, because knowing how to handle this invisible threat and understanding the science behind it might just save your life. Thanks for joining me on this explainer, and stay safe out there.